Endometrial corporal polyp is a benign polypoid lesion caused by abnormal proliferation of the endometrial stroma associated with glands and medium to large thick-walled blood vessels. Under the microscope, we can appreciate polypoid lesion. It means we need to see at least 3 sides lined by superficial epithelium, and inside of the polyp we usually see endometrial stroma, which is slightly more fibrotic, and it has slightly different appearance than normal endometrial stroma. Normal endometrial stroma is basophilic. Here we see more spindle-shaped cells with more voluminous, slightly lighter cytoplasm, and therefore the stroma looks like light pink or fibrous material. In the endometrial stroma or fibrous stroma, we see multiple endometrial glands, and most of them are slightly irregular. They can be dilated, irregularly shaped, and quite complex. No atypical epithelial features should be seen, and we need to exclude endometrial intraepithelial neoplasia or endometrial adenocarcinoma inside of the polyp. Here we have the thick-walled blood vessels in the stroma, which is the third important component of the endometrial polyp. The endometrial glands are typically lined by pseudostratified proliferative type of the endometrial epithelium. We can see some mitotic figures here and there, but no cytomorphological atypia. So this is endometrial corporal polyp. Thanks for watching.